Hello, my name is Arlene Salles. I am a senior researcher at Uppsala University in Sweden. My talk today revolves around the potential contribution of neuroethics to the ethics of AI. Neuroethics and AI ethics have been gaining prominence in the last few decades, typically carried out by different research communities. Recently, however, some neuroethicists have begun to call for a collaborative relationship between these two disciplines. On what grounds can such collaboration be justified as productive and impactful? The aim of this brief talk is to outline how a collaborative relationship between neuroethics and the ethics of AI can be beneficial and at the same time stimulate theoretical and practical advances. Neuroethics can be broadly defined as a field that addresses scientific, philosophical, ethical, legal, and social questions raised by neuroscience and related technologies. It emerged as a response to advances in neuroscience that have challenged foundational beliefs about free will, autonomy, moral agency, and even about the foundations of our humaneness itself. Neuroethics is both multi and interdisciplinary. Different disciplines have fed its development. And it's interdisciplinary because it integrates the different insights, and as such, it cannot be easily subsumed under one particular classical discipline. What type of work do neuroethicists do? Well, they use moral reasoning and a number of ethical approaches to deliberate upon and manage diverse applied ethical issues, such as those raised by informed consent, handling of incidental findings, data protection, those with clinical relevance, such as those that emerge in the treatment of pathologies of the brain. They also focus on the potential impact of neuroscientific findings on society and on those questions raised by science communication. But in addition to that, they do empirical work. They scrutinize science, neuroscience, and use neuroscientific data to inform theoretical and practical issues, such as who is a moral agent, what is moral reasoning. Finally, they undertake conceptual analysis of main notions, assumptions, interpretations, theories underpinning the research. The aim of neuroethics is not just to identify and manage the relevant ethical issues when transferring neuroscientific findings into society, but also to make neuroscience itself ethically better. What about AI ethics? The term AI ethics is used to refer to the area of inquiry that addresses the social, regulatory, ethical, and philosophical dimensions of the development and deployment of AI. The ethical issues covered range from the ethical usual suspects, we could say, potential breaches of privacy, biases, promotion of inequality and discrimination, to arguably more unique issues such as increasing automated social surveillance, transformation of agency, the possibility of AI as a form of consciousness. It is also multi and interdisciplinary. What do AI ethicists do? Of course, they do conceptual and empirical work, but AI ethics displays an undeniable focus on principle-based ethical guidelines and recommendations as a way to deal with practical issues. This means that, in fact, we see a specific normative concern in AI ethics. Despite the fact that neuroethics and AI ethics have developed independently from one another and that they have a different identity, recently there have been calls for mutual collaboration on the grounds that they share certain domains, they use common concepts, and that they raise similar concerns. To briefly illustrate overlapping domains, AI technology is implemented in several brain-related areas, for example. In turn, they use they use certain concepts in common. For example, AI and AI ethics often use terms such as intelligence, consciousness, learning, neurons, synapses, autonomy, obviously borrowed from neuroscience. And in turn, for many decades, the brain was described in computational terms. Finally, they raise common or similar concerns at the practical and theoretical levels. For example, both AI and neurotech applications often raise issues of transparency, fairness, and bias. Both raise issues about potentially transforming the status quo Both may place humans in general or certain humans in particular in position of vulnerability, among others. So if they're going to collaborate with each other, how can that happen? What I would like to propose is that it is possible to focus on some specific areas in each of the fields that could be benefited by interfacing with the other discipline. However, for the sake of time, I will just concentrate on how neuroethics can contribute to AI ethics. And I believe that in this respect, it is possible to identify two areas where AI ethics would benefit from its interaction with neuroethics. One is conceptual clarification. At times, AI ethics debates, and in particular guidelines and regulatory documents, are often conceptually vague, taking the meaning of ambiguous notions such as intelligence, autonomy, agency, consciousness, or categories such as anthropomorphism or principles for granted. To provide an example, consider consciousness. The potential issues raised by conscious AI depends on how consciousness is conceived. If consciousness is conceived, or if it is understood as a biological phenomenon for which the biological component is crucial, then emulating consciousness artificially is not achievable. While if consciousness is understood within a functionalist and computational framework, its artificial implementation would be conceptually consistent, even if still practically not possible. This in turn means that ethical concerns regarding conscious AI are at this time either groundless or possibly premature and misleading in the second case. The same can be said of the approaches used to address some of those challenges. Everybody agrees that AI should be designed and deployed for the benefit of humanity. But what does benefit mean? Well-being, flourishing, sustainability? What benefit means is not self-evident, which means that, again, conceptual clarification of important notions is key. Now, how can neuroethics help? Of course, we cannot say that neuroethics is always conceptually clear. However, neuroethics has tended to be much more aware of its conceptual obscurities than AI ethics, and has done more to overcome some of those specific problems. In particular, many neuroethicists have developed methodologies using conceptual analysis as a means to improve, enhance ethical discussion. Why this emphasis on concept and conceptual clarity? Well, conceptual analysis is important because it has implications, normative, theoretical, social. Misleading conceptualizations can alter citizens' perceptions of science or emerging technology in general. It can negatively shape people's attitudes towards scientific findings or resulting technologies. It can actually prevent a meaningful discussion of the issues. When main concepts are not clear, people really do not understand what the issues really are. Therefore, it's very difficult to carry on with a productive discussion. So in this respect, I think that AI ethics would benefit from the kind of methodology that has been designed within neuroethics and implemented in this field. Let's focus on a second aspect that I think would benefit from the feedback, or if you wish, the example of neuroethics, and that has to do with cultural differences. Now, it can be said that there are three main things we can actually claim. One is that AI can have a significant impact on culture at the local, international, and global levels. Second, AI is shaped by culture, values, and norms. And finally, guidelines, recommendations, any type of document designed to ensure that AI deployment is ethical tends to work towards international consensus. Now, these three claims have not been much discussed within AI ethics. They have been discussed, but not as much as they should have been discussed. And my main concern has to do with the last, the fact that there seems to be a clear goal to reach international consensus when in fact we're talking about different cultures and different traditions and different values that might be at stake. So if that is actually the case, how can neuroethics help in this respect? Well, Neuroethics, we cannot say again that neuroethics has always been absolutely aware and sensitive to cultural differences. However, it has been much more willing to address, recognize cultural origins and criticize itself to a certain extent. And this criticism or self-criticism of neuroethics has led to questioning assumptions underlying prevalent approaches to cultural inclusion, and importantly, to working on a richer understanding of cross-cultural work to increase intercultural understanding and self-awareness regarding culture, where the focus is on cultural comparison in order to identify similarities against a background of differences, or to highlight difference against a background of similarities. And the focus is put on relation rather than on essential identities. So what does this mean? Neuroethics has designed, or is in the process of designing new methodologies to do true cross-cultural work. And what I propose is that AI ethics can actually use neuroethics resources, which allow for a richer understanding of the cultures involved. What is the road ahead, though? The fact is that AI systems are increasingly present in diverse contexts, from entertainment to work, from healthcare to education, among others. Now, as use of AI technology becomes more common in a number of social domains, it becomes more ethically and socially impactful. Now, I believe that in order to address those ethical and social issues, interdisciplinarity is key. AI ethics in this respect can benefit from neuroethics. Now, not just from neuroethics, it can certainly benefit from other disciplines as well. But in this particular respect, when it comes to attention to conceptual obscurities, and when it comes to culture, I think that it can take the resources that neuroethics has already developed. Thank you so much.